We have Senator Milacek here. Thank you for coming, Senator.
Absolutely.
I appreciate it. We're here to describe and introduce a new science that is hopefully going to replace some errors in the next 10 years. I have some documentation here, of course, and I will probably have you look at this, and then I'll give this to you later, and I'll show this to the camera. The first page here with the black on A says 5 on there, and look over on the side, it says lateral mass with superior articular facet. Can you zoom in on that? And it's saying there's one of them because it's a singular facet. So that whole surface right here is a facet, which is an articular surface. It's where bones come together to make a joint. And they're saying there's only one of them. That's in 1998. On the next page, same thing, saying a facet.
Now, who is saying this?
This is these 3 books right here. Let's see, I think and that first one is the Men's Color Atlas of Human Anatomy, which is this one here. Second one is Anatomy Coloring Book, which is this one here. And again, it's facet. They're only depicting one facet there. And what that is the top vertebra, the atlas, and it's where the head sits on top of the spine. And then this one here, 1992, Human Anatomy, this book here, they'll show, again, facet, and they'll have actually a deviation over here which shows 2. But that's 1992, and then in 1993 they're showing 1. In 1998 they're showing 1. And that's common. That's what our textbooks in every college is showing. And in all actuality, as Grandpa would say, I think I've given you a page here. This is Grandpa's text. He was published several times. And it says, it is glaringly evident that the illustrations appearing in our medical anatomy texts don't accurately depict the architectural design of the occipital atlantal articulations, which is where the head sits on the spine. The atlas in contact with the occiput, the occipital condyles in particular. And I'll show that to you here in just a little bit. From my website, which is the 2 behind that, I have a picture, and there's this bone right here. This is what they're picturing on the website. And you look at it, and I'll talk about it, and it says there's 2 pairs. One up top, one on the bottom, one up top, one on the bottom. You don't see it real clearly until you turn the page, and then you take a look at it, and you see they're separated, and you can look at that, and you go back and you look at it, and you say, well, you know what? I do see a little line there between the 2, that they are separate. And in the text that Grandpa had written, that was published back in 1985, what happened was that my cousin, who's a licensed osteopath up in Denver, was going to school at the Texas College of Osteopathic Medicine in Fort Worth, is what it was. And they were talking about that particular joint, and I think his name was Dr. Carnes. And Joel says to Dr. Carnes, that's not what my grandfather says. And he says, well, who's your grandfather? And he told him, Earl Craton, who I'm finding out now, I always said he was the best. And he was. He got the Centennial Award in 1995. He was the top chiropractor of them all. I knew he was good. But in the documentation and the research I'm doing now, I'm finding out he was really the best one there was. They recognized him. But he kept all of his research inside the chiropractic profession. He never went outside of it. And of course, I'm kind of in a position where I have no loyalties to the chiropractors. I just want the world to know, because I need to do something with this. You know, I'm going to keep Grandpa's work alive.
So what is the main thing that you're...
What it is first of all, Grandpa always said, if you don't understand the architectural design of that bone, if you don't understand how many facets and what form and shape they're in, he said, how can you possibly understand how it works? If you don't know the form, how can you understand the function? And he wrote a book, and in his book, he talks about how the authorities are saying that it's a sliding or gliding joint. I'll show you. And what it is here, they're saying, can you get me there? They're saying that this is kind of a glide, where it glides back and forth. They're thinking this is only one surface. As I'll go back to, they pull in this dissection, what it was. They pulled the head off of a fresh specimen. He was a male, 30-something years old. And when they did, they found a capsular ligament around this facet, a capsular ligament around this facet, and then another one around both of them. So it actually, in a fresh specimen, was very distinctively separated by, of course, the capsular ligament, which I really can't explain that to you in layman's terms, but it is a separation, which makes this joint work altogether different than what they understand.
Why did it take so long before this?
This, unfortunately, many of our medical practitioners are being taught on plastic replicas, basically. The bones, I went over to the hospital and these are real bones. I bring the bones over, and it was the assistant director, and he's kind of, ooh, you know, real bones, you know. So people are kind of taken aback by actually studying and getting their hands on dead people, I guess you could say, because these are dead people. But he looked at these were Grandpa's tools, and he looked at these and he got to look and he said, well, you know what, there's a facet here, there's a facet here, there's a facet here, and there's a facet here, and he was, you know, he wasn't taught that, and he's like, well, I can't believe I'm seeing that. And so he'd look at it, and he'd look at it, and he'd pore over it, and he'd say, you know, I see that, I see that. And he talked about it and convinced himself that that was true, and then he was always wanting to prove that fact. And then when Joel came along with the college, the osteopathic college down in Fort Worth, they had a chance to actually get a fresh specimen, you know, with the tissue still juicy, basically. And they saw that he was proven right. And they are still not teaching that there is a pair of facets on each side. That needs to change. It has to change. Until they can see that, until they can get it corrected in the text, they will not understand how this head comes in contact with the atlas, the top. And what happens is the chiropractors, they'll come in here, they say it's a gliding joint, and it's not. It's a hinge joint. And when you have your chin tucked down, the head is resting on the front facets. When you're looking up, stargazing, or up at a tree, or whatever else, you know, it's on the back facet. So basically it goes front, back. It's like a swinging door, kind of, a hinge. And I think.
Is there anyone who is willing to take the lead in this? Like the chiropractors, or?
Chiropractors have actually stood in opposition to it. Basically, and I hate to say this, but basically if you get the client or patient well, why do they need to come back? If you're only getting $50 to put that, to manipulate the spine, it's not going to pay your bills, and they're going to go bust. That's a fact. And the system has got to change. Grandpa charged, I think it was a $2,000 minimum fee, and that was 25 years ago, and then he increased it, of course. And last time he practiced, 10 years ago probably, except for on the family. And I think, you know, he wasn't really, I mean, he was retired, you know, and he didn't want to be in practice anymore. So, but what it was is $2,000 up front, which I'm saying honestly, thought about it, looked at what the chiropractors are charging, $5,000 up front. But it's not for a treatment. It's to get the person well. It's to set the head in place. It's to position the hips. It's to monitor the progress. It's to get rid of any tonoplasts that have deposited themselves in soft tissues of nerves, muscles, ligaments, you know, all the soft tissues. They can get in the brain even, and I'm not sure what to do for that. I really don't know. I figure nutrition is probably a part of that. Back to this, what it is, yes, that's it. The chiropractors will come in, you go to a chiropractor, they'll lay you down on their back. They'll come in here and they'll snatch, of course this is an exaggeration, but they'll snatch on the atlas. They're trying to move the atlas underneath the head. And what they'll say they're doing is decompressing a joint in order to allow, like basically kind of getting this apart just enough to allow for the body to reposition it. And they'll do that 3 times a week for 10 years. And sometimes it helps, and sometimes you have a headache from the experience, and sometimes people have been known to be put in comas for that experience. Grandpa discovered that what happens is the head can either move, can you pick this up? I'll show him. It can either move right or left, and either time, when it does do that, it has to go clockwise or counterclockwise. So you can have right clockwise, right counterclockwise, left clockwise, left counterclockwise. 4 possibilities. But it's only moved 1 out of those 4 possibilities when it does subluxate or partially dislocate. The chiropractors are dealing with what's called a vertebral subluxation, which implies that the vertebrae themselves will subluxate or partially dislocate. They don't. What they do is they compensate for a weight of about 10 to 15 pounds being in a wedged position, putting stress on this atlas, and it'll shift. And as it shifts, these vertebrae over here, which have basically, I like to call them water balloons in between, which is the intervertebral disc, they have to compensate for the stress of this being slightly out of place. And then 2, another factor that this is basically completely ignored. They don't know anything about this. This is the sacroiliac. This is the innominate, and this is the sacrum. And what happens is, it's supposed to set like so. The pubes up front here will be, get that, can't see very well. Jason, move up just a little bit, sorry. Can you rotate it back this way? There we go, that's better. Okay, the pubes will be level, the crests will be level in a normal, healthy individual. What can happen is this will subluxate or partially dislocate, and it'll go like so. Bring the pube on one side high. Drop that down a little bit, Jason. No, the camera. Take the camera down. Pan, there you go, like that. Okay. The pube will be high on one side like so. It's hard to show. And the crest will rotate like so, and the crest will come up and you'll have a high hip. You can put your hands on the top of the pelvis like so, and you'll have a high hip if one of them is out of place. Probably 80% of our population is right now, as I speak, suffering from either a subluxated innominate or a subluxated occiput, because nobody is dealing with it. If you can get this weight of 10 to 15 pounds back where it belongs in the center and it's balanced right, there's no reason for this spinal column to compensate for it. And if there is a compensation, the body will go about reversing it. If this pelvis is subluxated, this sacrum has got to tilt to compensate for the stress of this joint not working right. And again, from the bottom up, the spine will compensate.
Where does your information come from?
From Grandpa's research. He was, the last half of his career, he practiced from 1925 until he died, essentially on me anyway. The last time he ever gave me a treatment was 2 months before he died, which he died in January. He lived 99 years, 6 months, and a week, so he almost made 100. And for the 40 years before that, like say from 1955 on, basically he told me, he said he wasn't satisfied with the failures of the profession. He wanted to know why what they told him would work wasn't working. And so he set off on his own independent research. He had no board to answer to. He had no body to satisfy. He wanted to know the truth, and he wouldn't go for anything but the truth. And so when he found these things, he said, he told me it took him 10 years to stand up and find the strength to say, there is no such thing as a vertebral subluxation. He said it's a compensation instead. And the chiropractors just, oh, Earl, you're crazy, you know. They thought he was nuts. And you go into a chiropractor's office, they'll have documentation, literature laying out saying, talking about the vertebral subluxation. Then they changed it, oh, now it's the vertebral subluxation complex instead, which is trying to kind of broaden the horizon, I guess, or the scope of understanding the vertebral subluxation which they're working with. And they're dealing with a compensation for this being out of place or the head being off-centered. And if you consider this guy here, fix this guy up, where it's normal, and all it is feels like so, you just move it back. And it does hurt a little bit to have that hip put in place, but the head, I was fairly intimidated from the experience, and come to find out it's not near as difficult to move, and it's not dangerous in comparison to what the chiropractor is doing, which is just slam, slam. It's not specific. Like I said, I know that people have been put in comas for that process, and Grandpa's hurt no one. He practiced for near 75 years. And I mean, after they'd been to the chiropractor, after they'd been to the osteopath, after they'd been to the medical doctor, you know, they'd been to every specialist. And then they came to him through word of mouth of somebody who'd known him. And he would get that person well. He got people out of wheelchairs. He figured out the reason why asthma exists. I can't tell you the things he did. He worked miracles. He really, really did work miracles. And I've been studying with him since '88. I was a patient. He saved me. I got to say sincerely, if he had not been in my life, I would either, one, be dead or crippled. One or the other. I know it. I know what it feels like to hurt. I have hurt so bad I couldn't stand up in the morning. I have had headaches, you know, migraine headaches, which disappear if you can put that head in place. And I can prove that, you know. I've seen it. My husband used to have them. I got them one time. I had them for a week, for every single night. My husband had ran off the road. We bounced around a little bit. My head landed off-centered a little bit. The light triggered a headache for me every single night. It was the worst pain I had experienced my whole life. I went to the emergency room at Bass, and I was concerned about a bleeder or something in my head, and didn't know. It was weird. I'd never experienced anything before like that. And they talked about musculature, you know, problems in the neck, and I realized that, well, the head's got to be out of place based on what they're telling me. So I looked them straight in the eyes, and I said, with all due respect, I said, you're simply not qualified, but now that you've helped me to rule out something else, I will go see the man tomorrow. And I did, and he fixed it, and I never had any more problems. It was amazing. So I know that it's true. I know it's true. There was a girl, August's age, 13, 14 years old. She used to get migraine headaches. She came by the house one day, fixed her up, the migraine headaches disappeared. I mean, just like they disappeared, gone. And I don't know why, except for that the head is in place. The body and the brain are communicating accurately now, and things work again, basically. It's very basic, it's very simple. The body does heal itself. It really does heal itself. So that's basically it. You have any questions at all?
It's very fascinating.
Yeah. I have a whole, this is what I've sent out to the, well, where did it go? Here we go. This is what I have sent to, I've contacted 4 insurance provider networks so far. This was a letter that went ahead of it. Of course, this is just one of their guys, you know, miscellaneous. But I put this all together, and it's the documentation that I showed you, plus a lot more stuff from my website, experiences I've been through. I worked on 3 chiropractors myself, 2 local and 1 in Tulsa. That's for you. Take that with you. I worked on two chiropractors local and a chiropractor. Yeah, it is. Chiropractor in Tulsa, and 6 of the chiropractor in Tulsa's problem cases in June of 2000, and got results. I mean, it was his tough cases. Got results when he could not. In fact, one case, he'd only hurt himself for the year previous. In fact, it was the anniversary day. He was like 35 years old. And he said to me, comes in and shakes my hand. He says, I'm a professional chiropractic patient. He rattles off the different guys he's been to. He's been to 4 of them, including the guy whose office I'm meeting in. He's been in care for a whole year. And he says, if you've got anything different, he said, I'll be able to tell you. I fixed his position of his hip, and I fixed the position of his head. I mean, it was boom, immediate. He jumps up off the floor. I mean, his face just lights up. He starts moving around, bending and twisting. He gets back down on the floor. He does exercises and moves all around, and he says simply, you know, I couldn't do that 5 minutes ago. I couldn't do that 5 minutes ago. He jumps back up, big smile on his face, shakes my hand a couple times. I'm so glad to have met you. I'm so glad to have met you. And those things happen. They really do. It's a wonder, and it's something I just really love. I love the experience. I had a client show up yesterday. I didn't know that I could help him. He had tingling sensation down into the hand. And I looked him over and I said, well, your head's out of place. So I fixed the position of the head. And I said, it didn't do any good for him right away. And I said, well, I think it's probably compensation from the spine because the head was off. And the spine had probably compensated for it. And I said, give it a little while. Gave him some exercises. I said, give it a little while, see what happens, and see if it doesn't take care of itself. He showed up downstairs yesterday just to tell me, you fixed me. He said, sure enough, he reminded me what I'd said. He said, sure enough, 2 weeks ago, he said, it went away. He said, I couldn't ride my bike before without having pain, which was his means of transportation. He said, I don't hurt anymore. He said, thank you, thank you, thank you. So that's pretty much it. Yeah. Thank you for coming in. I appreciate it. I better get you out of here. Okay, guys, you can turn that off now.
Now you had an accident when you was 25.
25 years old. I fell flat on my back out in the yard mowing the lawn, and I've had problems with my back ever since.
Accident age 25, and you fell on your back.
All of me hit the ground at the same time. My feet, the grass was wet, and I was mowing the yard, and my feet slipped out from under me, and down I went.
You fell on the back full length. Well, when did you first start going to car parties?
Gosh, I really don't remember. And there was one, I think there was only one in town when I first started going, and he was down there close to the square, but I can't remember who he was.
But I'm going to put down here taking chiropractic treatments. For the past 10 years.
I'd even taken some before then, but like I say, off and on periodically. But I've been going pretty regular for the past
12 years. Right?
probably so.
Now they give you temporary relief.
Yes.
This is torn down a little bit more than the other. Can you toe this in here? Now, is that uncomfortable to you?
No, not really.
Now, Al, can you get my thumbs where my thumbs are? Now this thumb seems to be higher to me than this one. You got it?
Yeah.
The superior spine of the ilii, that's the name of it. And they should be the same height, and this one is higher. And it's higher when you're on the other side, so that's positive that this hip has, on this left side, has, on the spine, has done this way. A counterclockwise rotation. And that is what has got to be corrected in this back. Okay. Right, come over here, Eve. Is the arch the same or one deeper than the other one?
This one is deeper as far as I can tell.
Yes, that's my opinion. She's got a lot better arch here than she has over here. And this is the short leg. Easy. Now, this would show when this is done. And you see this is low. I think that's all in the arch. I don't think it's anything at all. Back to normal, and it corrects itself, you see.
And I have a sore spot a lot Right up here in the top part of my head.
You know what?
I have a sore spot a lot of times. My head gets sore right up here in the top
Mm-hmm.
and this ear. And that's my sinuses or something that bothers me all on the right side.
Now we checked this with this squeeze test, you remember?
Mm-hmm.
This side was much more tender than this side. I'm going to see if this is still so this morning. Now you feel that just like it did the other day?
Mm-hmm.
About the same.
Yes.
All right, now I'll get to the middle one.
That one's really tender.
Hmm?
That's really tender.
Yeah, and it goes farther up into the head than the other one?
Yes.
Hmm?
Yes.
All right, we didn't do this the other day, but we're going to do it now to confirm this. Now this muscle, and those that were supplied, is supplied with the same nerve. And this should be more tender than the other side. Now let's see if it is. Now, you feel that up into the head?
Yes, it goes right up this way.
Okay. Now get that. Now we'll do the same thing on the other side.
No.
Okay. And the hip has done this on this bone here, so that it is rotated counterclockwise this way. And I've got to fix it. I've got to bring it this way. See, this way. And there'll be a popping and cracking most of the time in this joint here. And that's the only joint I want to move. Do it. Now we're going to try it with my knee anchored on this. And I want you to give me this ankle. Now, if this, when I pull this up, and this hurts you too much, you let me know. Because I'm going to raise the knee up, and I'm going to hold this down.
That hurts.
Huh?
That hurts in
It hurts where?
in this part of my leg.
Yeah, that's relaxed. It don't hurt so bad now, does it? Okay. Now I think we can turn you on your stomach and we can lift this up, and this one hurt you so bad. That's the air for this. The pelvic bone. And I'm going to press it down when I work. Now give me your ankle again. Now we're going to raise the knee like I did before, and you tell me if there's a change in the way this tension is.
It still hurts some, but not like it did.
Okay. Now I want you to lie just as limp as you can. I'm going to go to your
I can't stand that. I can't stand it.
There she goes.
Yeah.
Boy, I did a good job there.
Oh,
I bet you did.
That went back over into place.
Yeah.
Now, integrity and the strength of the ligaments will hold these bones where I put it. Now, this has been out of place for 33 years.
Probably a miracle if it ever stays there.
Now, there have been compensations for this, with the spine bending to balance her. Now, these compensations are no longer necessary.
So they'll redo themselves.
So the quicker that that what has become a pattern through here is changed back to normal, the better this will be, you see. Now, nobody has done this to your back.
Nobody.
Nobody has ever set that back where it belongs.
They just
And so,
pop my hip and pop my back and my neck.
Hmm?
They pop my hip, my back, and my neck, and pop my arms back in joint. Let it go.
now is this very tender?
Not right at that spot.
How about here?
That's pretty tender there. And there.
And I see the spine twisted here, and now the secondary curve is twisted here. And this has got to be loosened up enough so that when you stand up, it can move and help balance you right. There's nothing out of place here. The whole spine is kind of grown that way, you see, and it has restricted the movement of these, so that when you walk and all, there was a binding into here. So I want to increase the range of movement of these vertebrae along through here, so that when you stand up, it can accommodate to this new base. That's good. Now there's no vertebra from here to here that's out of place. Yeah, they've just kind of grown this way to accommodate for this position here, you see? And that has restricted their movement. What I'm doing is trying to loosen them up so that when you get on your feet, they can make the balance for this new position, see? Now I'm going to give you an exercise where you can help this.
Okay.
Well, I'm going to put you up on your feet, and we're going to see how we can measure. Look at that. Level as can be. Move to the left,
Yes, sir.
and then rotate it.
Yes, sir.
Well, the way I fix it is to get my forces so that I can put it back in center and straighten out this thing. Now, to pull the head up away from the spine allows it to get back into place better, see? And the more you can relax and just let me have it, the better I can do it.
Okay. I'll try.
See? And instead of pushing it over, we pull it over. We get a contact on this side and pull it from too far left back to center, see? And at the same time, this head is rotated a little bit farther this way, since we straighten the spine up, and it's got to come this way. No, sir, that's got to come from clockwise. Through here. The head is twisted this way too far, but it appears like it's this way too far. See? And we've got to set the head around this way on the spine. Now here comes the, oh, wait a minute. That's turned out good, didn't it, huh? Okay. Now I got to lift you up, and I got to turn the head as much as I can this way. And then I want to pull it from too far to the left back to center. And so let me do it. This is the trouble in my work where I have the doctors kiss my leg. Now, lay back and kiss my leg. Come on, lay back. Now I'm going to raise you up. Come on, all right. So that's right, that's right, that's right. And I want to twist your head. Let me have the head. That's good. Wow. You would have straightened this up better, but I had to go along with this curve to make the joint the bones on the skull get spine. Now, okay, now I'm going to take another. Now, you feel comfortable, do you?
Mm-hmm.
How it feels.
It just goes right there where you're pinching.
You don't go up into the head at all, does it?
No.
You see, we've taken the insult off on these nerves that supply these muscles.
Yes, sir.
Now that's the first time, all of this time, that somebody actually changed the position of that head on the spine.
You made it feel better.
Hmm?
And made it feel better.
Can you tell any difference in the way it feels?
Yes. And my back feels more relaxed than it has in years.
Stand up and I don't believe it.
Okay, now this one, let me see. I think
That was a deep one.
this was a deep one before.
Yes, that was a deep one.
It doesn't feel deep like it did.
Huh?
It does not feel deep like it did. Can you?
And all this up through the head here is going to feel so much better. Now, there's this trouble that you complained to me about, you know, you go to bed, you go to sleep, and you hear the dogs bark or something, and it keeps you awake practically all night. You see, it was that arousal center in the brain was being bombarded with signals that were noxious, they shouldn't be there, and it kept you awake. Now, if we can calm down these noxious signals, you can sleep.
And also my neck was hurting me. I had to put a towel or something under my neck or get another gown and fold it, put under my neck there to keep my head and neck from hurting me.
Listen, this head from here, just the head itself, weighs about all the way from 10 to 12 pounds. Now that's sitting on a stem of seven flexible vertebrae. And when that head is slipped to one side, the center of gravity always changes, and the spine has got to bend in order to balance it, doesn't it?
Yes, sir.
Well, that's what it's done. Now I've come along and set the head back where it belongs, and the consequences of this, of all this holding the head in that position, has more or less grown that way, and this isn't all gone yet. So until this is all gone, the head still got to do too much muscle work to balance it. But when they can do that, the head will just sit up there with very little energy.
And I had felt too like this rib cage here was right in here when I would feel it at times, like it was either swollen or it was big, you know, kind of stuck out more than the other one did. So it was all caused from that.
Yes. Yeah. As the spine, you see the ribs are attached to the spine. As the spine turns, it changes the whole contour of the ribs, see? And that's all changed. Now let me show you this last picture. Now I want you to spread your knees a little bit apart. There. Now that gives you a better balance, see? Now listen to what I want you to do. I want you to raise the body actually as high as you can. That's as high as you can arch it. Now, without bending the elbows, I want you to drop the shoulders as low as you can. Quick. Okay. Now do it. Now do it quick. Yeah. Now up, down quick, and keep those elbows from moving. Up, down hard. Up, down hard. Now, we're going to incorporate another movement. When you go down, let the head hang down. And when you go down, let the head bob up. Now, come on.
And when I go down, let my head go down?
No, head up.
Head
No.
up.
Now, when you go down, let the head bob up.
Okay.
Now, come on. Now, come on. Let the head hang down. Now, drop your shoulders.
There you go. There you
That's
go.
it. Now do it real hard.
There you go.
that'll take me some practice.
Now, I want you to watch me.
Okay.
You see, if you get your hands back too far, you don't get it. Too far ahead, you don't get it. And your knees, if you're too close together, you won't have stability. So I just do it that way. See? Now watch my back. Up I go, and then down. See, quick, hard. See, hard, and keep those elbows from moving. Now do that, and I want you to feel what's happening in this back. Up. Down. There. Get it. Now, come on. Yeah, now you get it. Now, you feel that moving all through there?
Mm-hmm.
Now, every vertebra in your spine, from here down to here, is being straightened out. See?
Mm-hmm.
So if you do this every morning and every evening for about 15 to 20 pumps, as hard as you can, you will accelerate this process of this getting back to as normal, see?
Mm-hmm.
And you don't need to go spending money with masseurs or chiropractors to do it. If these things stay fixed, this will take care of itself if you exercise it and direct it toward this normal.
Yes, sir.
And that exercise, you don't take any equipment. All you do is get on your hands and knees and do it.
I will do it.
Okay.
Are you recording this?
Yes, we are right now.
My lawyer's name is Paul Woodward.
I
He's
don't
out
like
of
it.
Enid.
Now you have to catch me doing all this, August, okay? Okay, we gotta get him straight up with the camera. There we go. What we're looking for is the top of the pelvis. You
See
know
how
that.
crooked it is?
Make this
Your head
straight.
is in the way.
Come on, get your feet. Come on, put them apart underneath your shoulders. There you go.
wait for me.
Okay, come on over here, Jerry. Now she needs to watch this. Just keep filming. It's okay, August.
intermission.
Well, hurry up.
Just look at his butt for a little while. Keeps me entertained quite a bit.
Mom,
Well, 3/4 of the work
Mom.
is making sure.
why don't you move it this way? Why don't you guys move over this way so I can actually see him instead of your...
Well,
Big
hang
head
on a
in the
second.
way.
I'll get down out of the way. Hang on. I'll let you decide. Okay, so
Okay, I'm here.
top of the, can you get that? So that's top of his legs.
Move your
Okay,
head.
level.
Move your head.
Top of his leg. Here's what you do is you get up the legs and you feel, and you get the bone is just hard. Okay, and you get up here, and this is the top of his legs, and you move them back and forth a little bit. You can feel the movement there, and
I see
get
it.
on top, and that's level. And if it's a little bit higher, it's a little bit higher on the left side, but it's not bad.
So he's not popped out
It's not bad. That's the top of his legs. We haven't checked the top of the pelvis.
That's
That-
where it gets.
okay. And what happens
See,
is,
that side looks way lower to me.
yeah, he's a little bit lower. It's not bad though. It's certainly not as bad as what we're going to see. Now this is the top of his pelvis. Lift your shirt up, Jeff.
You just go right to that point, and you know, right, that's
Yeah, well,
where it's at.
You just get to feel on it. Here, come here.
See, she don't even know what to feel for.
Just feel. That's the bone. You feel the bone? All that hard stuff, that's the bone.
Muscle.
No, this is the muscle. The bone.
What are you doing?
Quit
Quit
it.
it.
See, on top of the on top of the
No,
pelvis.
it's not.
And you see how high
Don't put
that
your
is?
hand over there either, Jake.
It's way higher on the right, on the left side. You see that, August? We don't even need to get the ruler to see that, do we? You can see that, right?
Can you see it?
Yeah?
She will. It's higher on the left side, right?
Way.
Way. Okay. So now we know what to do. Lay down, Jeff.
Yeah.
Head this way.
Lay down screen.
Head this way. Make sure I get the right side. The left side. Scoot back a little bit. Hang on. Hang on. August, can you get it?
Come on, Dad!
Jeff
Scoot
knows
this
the
way,
drill.
this way. Here.
God, Maggie took up this whole space.
Okay.
must reach
August,
the
can you get all
Titanic.
this? Yeah. Okay, hang on.
Just reach the Titanic.
And all you do, again, you just feel for the bone.
Hope you remember the right one.
Move to the left.
That's the pelvis. And you get on top of it. You put your foot up here. Of course, that's how I do it. I'll show you. Over
Put her out the door,
Jeff,
Jake.
move your right arm up before I can move my leg up. Okay, your. Can you actually see anything from there, August, or do we need to move?
Here, you might want to move.
the camera over there. That's a good spot. Just
Why don't you just move this way?
Why don't we just go the other direction?
Yeah,
like this?
it'd be easier like that, thank you.
okay. That'll work.
I
Okay, now.
don't know what I'm doing.
Okay, now. This is the left. This is the left shift. This is the one that's out. And what's happened is that, like I told you, the top has rotated backwards. The front is rotated forwards. So we got to bring it back around. It's like this right now. We got to bring it back around. Give me your foot, Jeff. Push your foot as high as you can. Okay.
Debbie, you win!
Oh.
I think I felt that move myself. Did you feel it?
Debbie, you all right, Debbie?
Lay there for a minute. Will you
As
wait
you
till-
can see, the patient is very exhausted.
Jeffy's thinking, oh my goodness, what happened?
Not so bad after you come out of the...
Initial shock.
This is fine, Mama.
You ready? Come on, let's get Jeff. Can you move, Jeff?
Yeah.
Okay. I felt it move though. Okay, now, same difference, we get square to the camera.
Jake and August.
Okay, now, we get
Are you
back
on
on
him?
top of the pelvis.
Directors take all
And look at that. You see that? You see that, August? You see how that just
I'm
leveled
looking,
it
move
right
your
up?
head. Move
You
your
see
head,
that?
Mom.
You see that?
Yeah.
And it's level now. And it was bad before.
Okay, give us 10 minutes in the bedroom and
Let's see if it works.
can you fix him again?
Notice the golf game on the TV.
How does it feel?
Bad.
Look at the top of the pelvis here, or like,
TV.
I think he's got a slightly longer leg on the left side. Just a little
It appears that way,
That'd
doesn't
be
it?
funny.
It does, just a little bit, which actually is going to cause an instability in the pelvis, which is probably going to encourage it to go back out slightly. So,
Where's I put a pin in it or something? Keep it there?
I got a pin.
I can get you a lift.
TV on TV.
Looks like you got a little bit. I'd
For
say
my
you
right
got a
shoe?
little bit- Yeah, for your right shoe.
Oh, I thought she meant for your truck.
I'd say you got a little bit of a longer leg on the left side, which is gonna cause instability. Turn around, Jeff. See that on this now? Do you see that? You see that now? It's level.
This is my living
Hold on, wait.
room.
Wait, move your head.
Does it look level now?
Uh-huh.
It looks
Now
level.
turn
to
around
me.
and give him a titty shot, baby.
See now, before it was way high, and now it's level. And it feels different to you, Jeff?
Yeah.
I think he's got a little bit longer leg on the left side, but I really do. It doesn't look real bad, but it is a little bad.
A lot better.
Come here, baby.
Tell that to the camera, Jeff.
He's good!
Oh.
Okay, now just close your eyes and sit straight.
Jinx.
Let me see. And he. Okay, he's.
Neck is a little crooked.
Yeah.
Isn't that little
Set up
volume
straight and
thing
relax.
48K goes up?
Can you see over me, August? Can you see over
Yes,
me?
I can see Jeff.
Okay. Actually, it doesn't look bad. His
course
ears
not.
look pretty level,
Dad
but he
knows
looks
to
like he's
shave.
looking just a little bit over here.
Yeah, that ear's lower.
That's the haircut.
Is your neck bothering you right now? Is your neck bothering
I think he needed
Is it
that.
lower
I
back?
thought there was
Yeah, I
fleas
can
growing
do
in his
that.
hair. Holy cow! You can see the skin.
you? Yeah.
A bald cat was making me look like he had more hair. Oh. As you can see, there is a very strange commercial on the TV.
Sit straight. Come back here.
Can you touch your chin to your chest? Doesn't hurt?
Does it hurt you?
Yeah.
Does it really?
On the backside.
Although they
Actually,
might
Jeff,
not
I
show
would
the
say you're
commercial
wrong.
on
I would say
No,
you're
no.
wrong.
live TV.
You look straight.
Blur it out.
Does it? Can you move your head okay? No stiffness or?
The pictures,
Your
no.
neck don't bother you? You don't have headaches?
Yeah, I did that picture.
Okay.
Remember?
Let's say it was just the
I painted that.
pelvis.
Remember where I'm
Clean
6
bill of health
years
for the
old,
neck.
and I painted that.
Head
picture.
on
Shot my
top.
pelvis out of
Pelvis
place.
was out of the left side, it's fixed again. It's your left side that goes out of place, okay? But I would have her look at it. She knows what to do to look for it, and it was pretty bad. I'm pretty sure Jerry could see it, okay? So you can have her verify it. And anyway, in either case, this is an exercise you need to do anyway to encourage it to stay in place, okay? And if it's
Yeah, yeah.
out of place, she could fix it if she just
After
follows
this
a
came
little bit
another
of,
fun movie.
tips here. Watch this. You can do this here just a minute, okay? He's
Okay.
not watching.
Yeah, yeah.
You can get your left leg, your left knee onto a nice soft surface like such. And you're gonna get like so. And you're gonna like put your, see that?
Yeah.
So you got yourself in a bend.
Yeah.
You just wanna stretch it.
Yeah,
Yeah,
there's a
like
left
that.
thing over her.
Yeah,
which
there's
is
a
not
separate
right.
knee up. It's like, keep your knee up. There you go. Keep this up too. What you wanna do is take my
Just put his pants out. So he can
There you go. Now you're on the right track. Now you got it. So you want to get this in a stretch. You feel that through there? And Jerry, all you got to do is just get over here and just kind of push like that. And you want to check it? It's fine. It's fine. And it should be level, just like that.
Move your head, Mom.
It should be level. And it is so easy to fix a pelvis, it's not even funny.
Right. And it makes the responses to the stimuli.
Yes, it organizes what the response is going to be.
Right.
And if that response isn't appropriate, things don't work right. If you give the wrong information, it's going to give wrong orders what to do.
So how are the chiropractors still, what's their philosophy now? It's still innate intelligence? Is all knowing, all knowing?
All of the so-called philosophy of chiropractic is based on that erroneous principle. It's got to be based on what comes in must be accurate in order for the body to make an appropriate response. Now, if you think about that, if you're healthy, anything that comes in and the body is capable of making an appropriate responses, if you set a fire, you don't have any time for that, see?
Yeah.
So you must be capable of making an appropriate response.
You have a quick adaptation then. Yeah.
And if the response isn't appropriate, then there's something wrong.
Yeah.
All functions are distorted. And that's all disease amounts to.
Yeah.
And medically, in their philosophy, they just talk about we want to manipulate things by drugs or treatments of some kind in order to have the body respond like they would like to have it respond.
Which overrides the current mechanism of
without the various drugs of anesthetics of some kind, whether it's just say as a rub on or something you inhale or drink, all of those responses are going to be distorted and inappropriate.
And you said without the drug?
And that goes on for 24 hours a day.
Yeah.
Pretty soon you're sick.
I'll be outside.
It's more than the body can take. Or you have a chronic disease like asthma, tuberculosis, rheumatism, gout, kidney stones, ulcers of the stomach, whatever, you name it. That's all the world disease amounts to, is the body has lost its ability to appropriately respond, either because of faulty information or the motor system, the motor side of the reflex arc has been damaged so that it can get its orders through. Now, other things enter into that. You can't live on coffee and donuts.
Oh, no.
And expecting the body to work like it should, see?
Yeah.
So nutrition is a big part of this.
Yeah.
Rest is a big part of this. The body has got to have time to recuperate and to rest.
Yeah.
And here we are, 100 years, as a profession. And we're still in that stupid era of not recognizing the things I've just told you. And until that is universally corrected, chiropractic is stunted. It can never expand and develop like it should by science to get sick people well. Because the body cures itself every time, always. If you cut yourself, when you scratch yourself, you don't think anything about it. You don't tell what the body what to do. You can say, well, I'll put a salve on this to keep it out of infections or something like that. But the healing process is an innate process that the body has been designed to take care of itself for eons of time.